Today we have a Neurology Pharmacology Step 1 question. This is a very high yield concept for Step 1, so stick around for the answer reveal. A 40-year-old woman reports recurrent episodes of severe unilateral eye pain. Each episode lasts 30 to 90 minutes and is accompanied by tearing, nasal congestion, and mild eyelid drooping on the same side. She says the attacks happen many times a day for several weeks, then stop completely for long periods of time. Which of the following is the most appropriate acute treatment for this patient? So straight off the bat, when we mention a patient having unilateral eye pain, episodes of ptosis, tearing, rhinorrhea, like in this patient, and it happens a couple days a week, and then it goes away for a long time and comes back, like in clusters. We're talking about a cluster headache. This is what the patient has. So now we need to know, how do we help this patient out? What do we treat her with? So let's start from options D and then work our way to A. Propranolol, used for migraine prophylaxis, not for acute treatment. It has no role in treating these short, severe cluster headaches. Prophylaxis here would be verapamil in cluster headache, not propranolol. Therefore, this answer is incorrect. Now, as for indomethacin, C, it's an NSAID and they're not really used to treat cluster headaches. They're usually used to treat tension headaches, which is a bilateral headache that's usually caused by stress. Therefore, C is also not the best answer in this situation, and it's wrong. Now, B, oral sumatriptan, which is a triptan drug. It's a serotonin agonist and it's used for acute migraine attacks. So migraines are very different than cluster headaches. With a migraine, you get photophobia, so the light makes your headache worse, sound makes your headache worse, you feel like you have nausea and you vomit. This is not a migraine that we're dealing with in this question, therefore B is also not correct. So that leaves us with A. So A, high flow oxygen, this is the correct answer. So this is the most effective and quick treatment for cluster headaches. So how it works is that oxygen causes rapid vasoconstriction of intracranial blood vessels. Usually with a cluster headache, you have a lot of vasodilation going on with the blood vessels in your head. So with this vasoconstriction caused by oxygen, this helps it out and it helps decrease the symptoms. It also helps with decreasing the activity of our trigeminal nerve, which is causing a lot of retroorbital eye pain as well. And also helps calm autonomic symptoms like the ptosis, the rhinorrhea, the tearing of the eye. So this is why it's the best option. However, for prophylaxis of cluster headaches, we give verapamil, which is a non-dihydropyridine calcium channel blocker. So for cluster headaches, you want to give a non-rebreather mask with 100% oxygen. It'll help clear the cluster headache quickly and treat it. Thank you so much for watching this video. If you enjoyed, please follow our Instagram, our TikTok, and our YouTube. Thank you so much.